Hello, Dr. Mahmoodi. You can start.
Hello, everyone. Can you see my screen?
Yeah, we can see. Please start.
Okay, great. So I'm going to talk about Oman Viva exam. If you can remember from Dr. Pandia's lecture, there is Oman Viva exam after you clear your prometric exam. It's only for Viva. Thank you. Only for Oman. Thank you for Dr. Pandia for his extensive explanations. So I'm going to talk shortly about Oman Viva exam. What is it and how you should pass it and other details. So what is Oman Viva exam? Oman Viva exam is an interview conducted by Oman Ministry of Health after you cleared your online exam. Passing this exam is necessary for medical license in Oman. So any field you're applying for, doesn't matter, GP or any specialty or subspecialty, you have one Viva exam after your online theoretical exam. So what do you need to register for Viva exam? 4 requirements. One is your data flow certificate. Second is your prometric exam certificate. You have to pass your prometric exam. 3 is photo and passports and other credentials. And 4 is a Viva form and a payment for your Viva exam. So where is the Viva conducted? You have 2 options for taking the exam. There's 2 options. One is online exam. It means you sit in your home, you log in with your Zoom application and you take the exam online. Most of the time they conduct the online exam every day in a week, except for Friday and Saturday, which are the off days in Oman. But you can also go face-to-face, go to the Ministry of Health, and it is conducted 2 times a month. The first and the last Monday of the month, they conduct a face-to-face Viva exam. So this is a really important question. Do they tend to pass the candidates who take the interview face-to-face easier, or would I fail if I take the interview online? And this is your answer: no, no, and a big no. Look at me. I passed my Viva exam like 3 months ago, and I take it online and I pass it in the first attempt. Okay, so no, anyone who's telling you if you take the interview online you're gonna fail, they're not sincere. Okay, so no, it is up to you. Okay, some of you may say, yeah, you know, I'm more comfortable to have the interview face to face, or I want to go and see there. I want to go see the ministry. I want to go see Oman. I want to go and see how it's look like. Okay, go, but it's optional. It's up to you. Okay, so no need to go there if you don't want to. Okay, you can take the interview online and pass at first attempt. Don't think about it. The next is, how many attempts do I have? It depends on your prometric exam score. If you have a score more than 70%, you have 3 attempts. If you have a score less than 70%, you have 2 attempts. In 6 months, it means if you failed 2 or 3 times, you have to wait for 6 months and you can reapply for the exam. And for every attempt, you have to make the payment. So who signs you up? Again, you have 2 options. You can personally sign yourself up. You can go to the ministry or send someone to the ministry with the payment, with the form, and with the credentials up. Or you can find an employer. You can find a job and the employer will sign you up for the Viva exam. But on my personal experience, I'm telling you, recently the employers are looking for the candidates who've done all the paperwork. Okay, so they prefer the candidates who passed their Viva exam. They did everything. Okay, so if you're in a hurry, if you want to go there faster, and if you're not in a financial pressure, it is easier. and they're gonna hunt you better for the job. And how much should you pay? It's 100 Oman Riyal. It's around like 260 US dollars for each attempt. Who interviews you? There is usually 2 or 3 doctors from the ministry who interview you. If you have 2 doctors,
Hello. Mahmoodi, are you there?
Can't hear you, dear.
We can't hear.
Guys, please wait. Please wait. She will come. She lost the internet connection. Please wait, okay? So until she comes, what I want to tell you is, if you are interested on subscribing Dr. Pandey's course, okay, or if you are interested in involving Dr. Mahmoodi's online practice sessions, so
hello,
I
I'm here again.
Yeah, she's back.
All right, okay. So you can take Dr.
So,
yeah.
yes, sorry, my laptop, I don't know, got turned off spontaneously. I don't know what happened, so I'm gonna continue.
Yeah, please.
Yes. Okay. So who interviews you? Usually there are 2 or 3 doctors from the ministry who interview you. If there are 2 people in the interview, there are usually 2 general practitioners. But if there's a third person, the third person is a pharmacist. And if the pharmacist is there, they might have more focus on the drugs and side effects and such and such. And what do they ask? They give you 3 to 4 case scenarios. They give you patients. They tell you, like, a patient comes to you with that complaint, with this complaint, what do you do? Most of the time, they're not looking for you to do to know the final diagnosis. They want to know, you know, all the differential diagnosis, at least the most common. And they want to know how you take the history, how you do the examination, and if they want for diagnosis, how do you do the treatment? Do you refer the patient, how to refer the patient. They ask about the doses, the side effects of the drug, and the advices you give the patient. So there is usually, I said 3 or 4 questions. Candidate usually gets 1 or 2 general medicine emergency question, 1 or 2 obstetric gynecology, and 1 like pediatric. If you're applying for the exam, for sure you're going to have 1 case of obstetric gynecology. So what should I study for this Viva exam? Technically, there is no official reference. For the online exam, for the theoretical online prometric exam, they give you a list of references, a very vast list of references. But for Viva exam, there is nothing, no official reference. That is why the Viva is the most tricky part, okay? They can ask you, technically they can ask you anything, okay? Because there is no reference. They want to know how you practice. And as you know, you can have any kind of patient in practice, okay? So they're allowed to ask you anything, okay? But they don't. Technically, if you're applying as a GP, they're asking the most common or the most dangerous patients you see. Actually, the Viva is a tricky, but it's my favorite part because it's what if you're a GP or you're a specialist, it's tailored to your field of expertise. You just have to know how to answer the question, how to take an interview, and what to read, okay? So these are a few useful texts you can use for your Viva exam: Oxford Handbook of General Practice, Oxford Handbook of Clinical Medicine, Oxford Handbook of Emergency Medicine, Oman National Guidelines. There is Oman National Guidelines for hypertension, for pediatric emergency, for PHC, and for so many other things. For asthma, you can use that. And there's case file books like 100 cases in general practice, emergency medicine, so and so, okay? But believe me, when I was going for my Viva exam, at first I didn't know Dr. Pandya. So I went over all of these references. Like I read these twice, okay? It's more than 6,000 pages. It took me a few months to read these. And I was so confused. I was absolutely sure I'm gonna fail. And I'm telling you, I would fail because there's so much details not needed, but you see in these books, and you take your time, you study this, and you still fail because so many of those details are not needed and it's not in the field of your expertise. But at the same time, there's little points they want you to know and you're gonna miss if you don't do study well. So what do we offer for you? This is a Viva book. I told you these these references all together, they are more than 6,000 pages, okay? But what do we offer is a short, easy to read text named the Viva book, written by Dr. Manjal Pandya. It is like a little more than 100 pages and it's easy to read and it's covered all the things you need to know for the Viva exam, almost all the things. But also we have coaching sessions and they practice with you. They teach you exactly how to answer the scenarios in your Viva exam. They tell you what kind of questions they ask, what they want from you, what should you know, and what should you not know or there is no need to know, okay? And also the coaches give you scenarios and they recreate the Viva for you. They tell you how to go there and what are the points when you're taking the history, doing examination, and they help you pass your Viva exam at your first attempt, although I told you it's the most tricky part. So these are some examples of the question they ask. Like they tell you, yes, there's a 55-year-old man comes to you with chest pain, what do you do? Or there's a 35-year-old lady, 9 weeks pregnant, comes with abdominal pain and vaginal bleeding. What do you do? Okay. So as you can see, they don't give you all the information at once. They just give you one sentence with a little bit of information. You have to dig deep. Okay. So you have to know the differential diagnosis, how to take the history, how to do examination, how to do treatment, when to refer the patient in different cases they give you. So what happens if you miss one question? Usually nothing happens if you miss just one question, if it's not a really rotten case, usually nothing happens. They give you the benefit of the doubt. Or if you miss some parts in one question, it's fine. But if you miss more than one question, you're failed. You're absolutely failed. Okay. So thank you. That was all you have to know about the Viva exam. If there's any question, I'll take it. Dr. Binoy?
Yeah, thank you very much, Dr. Mahmoodi. It's very useful, highly explanative, and also brief and up to the point. Thank you very much. So if anyone has any questions, can ask, please. Hello, please unmute your
Hello,
mic.
ma'am.
Hello.
Yes.
Hello. I want to
Yes,
Hello.
we can hear you.
know.
Go on.
I want to know what is the time gap between after coming results. What will when will these Viva exams will hold?
Okay. The Viva exam, if you take the Viva, after you cleared your prometric exam, you can apply for the Viva exam, okay? So if you take the online Viva, you have to first register for the exam. There is a waiting list, okay, different for the online and for the face-to-face, but you have to wait like for a month or 2 months to, it's your turn to take the Viva exam. And they ask you like 3 to 4 scenarios in their top, it's like 15 or 20 minutes in there.
Good evening.
Hello.
Hello. Hello. Good evening.
Your question? Yes, I can hear you. What is your
Yeah.
question?
My question is, if I clear prometric in a certain section, I'm a dermatology MO. If I do prometric in dermatology, that means the Viva will be same like or the stream oriented?
You're gonna have the dermatology Viva. There are gonna be 2 or 3 dermatologists from the ministry. They're gonna interview you. They give you the most common things about the dermatology. They give you cases. They need diagnosis, differential diagnosis, taking history, doing examination, doing investigation, treatment, and kind of this. Any specialty you have, you're gonna have the Viva exam for that specialty.
Okay,
Hi,
thank
good
you.
evening. If we are,
Thank you.
yep,
You're
if we
welcome.
are applying for the online Viva, how are we supposed to do the examination part?
You just ask them. Okay, you just say, okay, I'm going to do cardiac oscillation. Is there any murmurs? They tell you no or yes. Okay, you tell them, I palpate the abdomen. Is there any tenderness? Is there any rebound tenderness? They tell you yes or no. Got it?
Okay, thank you.
You're welcome.
Hello.
Any other
Hello.
questions?
Yeah, please go on.
Hello.
Yes.
Yeah.
Hello.
Yeah. Hello.
Yes. What is your question?
If I want to face Viva exam, where do I go to? I mean, is there a particular exam center to go, or I can face it through using my laptop or tablet?
Both. You have 2 options. You have 2 options. You can go face-to-face. It means you go to the Ministry of Health and take the exam there, or when you are registering, you say, I want to take online. So you sit in your home and you take it via Zoom.
Okay. Thank you so much.
You're welcome. Any other questions?
Hello, madam.
Okay.
In the website, when you register in Munjal Pandya website for the Viva sessions, how many practical sessions you might be providing us for mock scenarios?
Of course. If you sign up with our website, Dr. Munjal Pandya's website for your Viva exam, we're going to provide you with a Viva book, which is a really short, easy to read text for your Viva exam, plus few more other references. And plus we're going to have 20 sessions with coaching The main coach is me, myself, and also Dr. Munjal Pandia and Dr. RT, our pediatrician. We're going to have 20 sessions of coaching for you. We teach you how to take the Viva exam, how to approach to the different cases they give you. And we talk about all the details you need to pass the Viva exam at your first attempt.
Thank you, ma'am.
Hello, madam.
Yes. Hello.
Hello. When I'm having a experience in emergency treatment unit for around 4 years, and if I do a exam in emergency medicine, then do I have to have another degree emergency medicine in MD of emergency medicine to have a job?
Okay. You did your general physician MMBS. You did that. I'm sorry, I didn't get your question. Are you a specialist in emergency medicine? Hello, I can hear you. Are you a specialist in emergency medicine?
Hello, who is the doctor? Raise the question, please.
Okay, meanwhile that we're finding the doctor, I tell you, if you're a general practitioner, you're applying for Oman, you have to have 5 years experience. But if you're a specialist, 3 years experience is good enough. Okay, so is there any other questions?
Hello, madam.
Hello.
Hello. Madam, I want to ask that if actually currently I am working as a MO for around 7 years, but I don't have experience in one field for more than 5 years. Like that, I have 2 years experience in GynOps and 2 years in anesthesia and 1.5 years in ICU and around 7 months in NICU and like that type. So what is the best exam I should face?
So if you want to apply as a anesthetist, okay, 3 years of experience is enough. So ICU and anesthetics, I think, are together as one field. So I think, yes, 3 years in anesthetics is enough for you.
Also, madam, can I apply as a GP also?
Yes, you can apply as a GP, but you should have a 5 years experience in GP. And I'm not recommending that. If you're an anesthetist, as said by Dr. Pandia, don't degrade yourself. You're an anesthetist. You have like 3 years experiences as an anesthetist. Why should you apply as a general practitioner? You, as an anesthetist, you have a better job. You have better payment. So I don't recommend you to do that. But if you want to, yes, you can. But you should have like 5 years experience in general practice.
Madam, if I fail in the first attempt in Viva online, can I face the face-to-face Viva next time?
Why should you take Viva next time if you passed?
If I fail in the first attempt with online one?
I'm not sure, but I think yes, you can. Yes, you can. I don't see any reason why not. Actually, I haven't seen a case like this and one fail in the first time and want to change the mode the next time. But I don't see why not. Yes, I think you can.
Excuse me. In anesthesia, medical officer in anesthesia, what should I do? I can do anesthesia or GP as well. There's a
You can do both, okay? But you're an anesthetist, okay? So go as an anesthetist, okay? It's a better job,
No.
it's better payment, okay? So you can go for anesthetist. You just have to do prometric exam for anesthetist, Viva exam for anesthetist. You just have to apply as an anesthetist, and that's fine.
But at the moment, I like to appear as a GP. Therefore, can I sit for that one as well? Yeah.
Well, you can do the prometric exam and Viva exam, but experience do you have